Thank you, Mr. Chairman. And again, I just wanted to make a note that as someone who represents a district that's about a 50-minute drive from Newtown, I really want to thank the chairman for holding this hearing. This is the first hearing in the House side since the Sandy Hook incident took place. And I just want you to know it's not gone unnoticed. And hopefully some of our colleagues in other areas of jurisdiction in the House are going to take the incredible outpouring of reaction in response to Newtown as seriously as you did. And again, with that, I just again want to reiterate my thanks. Thank you to the panel. I'm sort of an all of the above guy in terms of a lot of the ideas that are being presented here today. In particular, the teamwork between school resource officers, school health-based centers, school counselors is something that I have witnessed repeatedly over the last month and a half or so, talking to school districts in Connecticut, and they are a team when they are working the right way. And also what I heard is that, one of the reasons why it's not like the good old days is that kids are coming to school with severe diagnosed conditions of mental health illness at shockingly young ages. And the one item that I heard, again, repeatedly from school counselors and educators is the fact that, again, even when you've got a fairly robust system of counselors and school-based health centers, the fact is that sometimes you need to refer out into the community for pediatric psychiatrists and adolescent psychiatrists. And in a state with Yale Medical School and UConn Health Center churning out physicians, this is not an area of profession where, frankly, we don't have near enough bodies out there to deal. I mean, the waiting time for even emergency situations is just, it's really just unacceptable. And I just wanted to see, Mr. Pompei, if you can sort of confirm that experience as well, that the need to refer out, which is required sometimes, is really very difficult.
Absolutely. School counselors, school nurses, we very much are aware of who's in the community. So part of our job is that middle person, that collaborator with the community. So we are the person the administrator will come to if they find out that there's a need, because they know the school counselor will have access in their file drawer, right, readily available to make sure that they can make those recommendations. We work very, very closely with the community-based mental health professionals for long-term care, and then we collaborate with them. So once they're getting that long-term care, we can provide the changes that are needed to make a positive transition for that student to come back to school, making sure we're working with the teachers to say, hey, these are triggers for this student, and making sure they're getting the training, and then meeting with that student as follow-up throughout the school day.
So again, as we try to consider what to do in response to this situation, I think it's important for us to know there is a loan forgiveness program for pediatric and adolescent psychiatry, which is through the National Health Service Corps, which is going to expire this year. And to me, this is an issue which our committee should look at. It deals with the needs of young people, and it deals with obviously a workforce gap that's out there, and we can fix that by re-extending that. And I would just lastly say, Mr. Bontrager, I mean, your point about trying to find a place for people to sort of get best practices, the REMS Technical Assistance Program at the U.S. Department of Education actually still does exist. They do webinars. They do have online information, but frankly, we should also try and follow that up with some more resources. And I don't know if you want to comment on that, and then I'll be done.
Yeah, I know the TA does exist, but the grants are no longer being offered for localities.
Right.
Could I just say that the Department of Education has brought the REMS TA Center along with the National Center on Safe and Supportive Learning Environments that I lead together to make sure that we coordinate our activities in response to these issues and to try to make those connections.